Hello, everyone, and welcome to our conversation today. I'm Monica May. I'm Tocagen's communications specialist, and I'm joined here now by Mary Lovely, who is a leading patient advocate and for brain cancer patients and their families and caregivers, and also a patient support liaison for Tocagen, who is a brain cancer company. So we're here today. As many of you may know, it's Brain Tumor Awareness Month, the month of May. And that month is all about raising awareness and providing resources and providing hope for patients with brain cancer and their families and caregivers. And that's what we are hoping to do today. And that's why we have Mary Lovely here. We're so happy and honored to have you here. Thank you for joining us.
Thank you, Monica.
Thanks. And Mary has worked with hundreds of patients and their families as they navigate through a brain cancer diagnosis, recurrence, and also life in the new normal after you've gone through all of that and adjusted to the new life. So we're hoping to hear from her today. We have some questions, some of the most common questions that she hears in her work. And we just want to hear her advice and perspective and anything that we can do to help. So I talked a little bit about Brain Tumor Awareness Month. But Mary, first I wanted to hear a little bit about you and your background and your current role at Tocagen.
Thank you, Monica. I am a neurological nurse, and I have been a neurological nurse for over 30 years. I'm also a clinical specialist in neurology, and I earned a doctorate in quality of life and symptom management for brain tumor patients. So I've studied patients in long-term situations, and I have been working with brain tumor patients for many years. I'm also a facilitator of a brain tumor support group in San Francisco, and I work at University of California, San Francisco, as a facilitator in a palliative care class. I'm also the patient support and liaison for Tocagen. And what that means is when people call in and they're asking about clinical trials, I respond to them, and I also provide resources and help them understand what kinds of information they need to move on with their trials.
Thanks for everything that you do, Mary. I know that patients and families really appreciate it. So thank you for that. I wanted to first start off with, we're talking about this month in Brain Tumor Awareness Month and what it means. But first I want to ask you, what does it mean to you personally?
Brain Tumor Awareness Month has been in May for years and years, and it is a time where everybody who's involved with brain tumors, be it healthcare professionals, patients, families, all get together and they move forward and talk about brain tumors. They go on walks. They also go to the government. They head to the Hill and they explain to the legislators the information that we need, or what do we need for brain tumor patients to find the cure and to live with a brain tumor. And recently, this year has been an exceptionally exciting year because the Childhood Cancer Star Act was passed, and it was passed after this push to go to the legislature. The Childhood Cancer Star Act is an act where they have passed money for research for children's brain tumors, also for quality of life of brain tumors, and also child surveillance. So for patients who may have brain tumors, they can watch them carefully throughout the years. So we're very excited that we're making progress. And that's what we do in Brain Tumor Awareness Month. We look for progress and we acknowledge that brain tumors exist and we have to make a difference.
That is so fantastic to hear. That is just absolutely wonderful. And another little piece of good news is also with all the walks that you mentioned, Tocagen also participated in the San Diego walk that was here too. And we just put out a call on Facebook if anyone wanted to help support and support brain cancer research. And through that, we actually ended up raising more than $1,500 that all goes to brain cancer patients and research and helping people just get to their appointments and things like that. So thank you so much. It's so much good news for this month.
It is good news.
That is wonderful. So I wanted to start with a couple questions today. I wanted to start out at the beginning for many patients, which is the diagnosis. And many patients up until that point have been feeling healthy and have been having a regular healthy life. And so getting this brain cancer diagnosis can be a total shock and come from out of the blue. So I was wondering what advice you have for patients when they first get this diagnosis.
It is a huge shock when patients and their caregivers find out that there's a brain tumor. I can recall several people in our support group being able to tell me exactly that moment when they found out they had a brain tumor. It never leaves their mind. It's just amazing. What do you do when you find out you've had a brain tumor? Sometimes you have to go directly to surgery and you don't even have a chance to think about it, and it's overwhelming. If you do have an opportunity, it's a great time to be able to develop a plan with your doctor. But we've found out over the years, the best thing to do is go to a neurosurgeon who operates on a lot of brain tumors, and to go to a neuro-oncologist who takes care of brain tumor patients on a regular basis. A neuro-oncologist knows the new and the best treatments for brain tumors. So the best thing you can do when you start out is research where are the neuro-oncologists. If one is not in your network, you can usually get a second opinion for a neuro-oncologist. So that's the first thing that you can do. So you create a treatment plan with the doctor. Many people also start looking online. That's just natural. We're the internet world now. So what I find is I will tell people about the specific resources that we have for brain tumor patients, credible resources. Because when you go online, there's so many of them. And there are many, the American Brain Tumor Association, the National Brain Tumor Society, Brain Tumor Network, all of these people will help you find out good information about what to do when you're newly diagnosed. So just wanted to bring that up.
That's wonderful. And that reminds me, we'll be posting the links to the websites and all of these resources, and even more than were just mentioned here afterwards. So you have them all in one spot.
There's just one other thing I wanted to bring up, and that is support. When you find out you have cancer or you have a brain tumor, it's absolutely overwhelming. And some people will start to isolate, but it's really not a time. And some people have to decide, do I want to tell a lot of people or do I just want to tell a few people? And it's okay just to keep your group small, but do find some support, because this is not something you can handle alone. And so that's the other part. Have some people on your side so you're not alone. And the caregiver needs it as much as the patient does.
That's true. I definitely want to talk about the caregivers too, because they are so important as well.
Right.
So for this, you're talking about the importance of support. And I specifically wanted to ask, for the caregivers and the loved ones or friends who have a friend who is diagnosed with brain cancer, what can they do to help that person? How can you help a person who's just been diagnosed with brain cancer?
It's overwhelming. And I want to just say that caregivers and people close to that person are just as shocked. And nobody can say anything for a while. It's like, oh my gosh, what are we going to do? It's really hard. So I think the most important thing is to stop, and for people who really are close to the individual with the cancer, to listen to them and to find out what they're thinking and what they want. And sometimes it's really hard because it's so easy to say, I think you should do this, I think you should do that. But listen to the caregiver, listen to the patient.
Right.
So listening is really huge. What happens a lot of times is then the patient has to devote all of their energy towards their treatment, towards their surgery, recovering from their surgery, and then going into their treatments. So the caregiver is often left with everything else that needs to be done. It's overwhelming. So it's nice when people can come in and say, what can I do? How can I help the caregiver? Because they're going to need to help with the finances, take the kids to school, buy the groceries, and delegate. So the caregiver will need to say, yes, I'll take the help, and here is what I need, and take it, because that's what's really hard. Also, to look for some local support services. I really believe that in the talk to the healthcare professionals and say, listen, I really need some help. And social workers can be really wonderful. And the nurses and the nurse practitioners will say, listen, here's some support services. You've got a brain tumor support group, or we have a caregiver support group. These people are just amazing. And also through your church and through your schools. And people do rally, but just find that support. That's what the caregiver needs to do, and embrace it.
Mhm. That's perfect. I was just going to ask, what I'm hearing from you too is that the role of the caregiver is so incredibly important. And I know you talked before about the importance of supporting brain cancer patients, and that's something that they is instrumental in as they go through this process. So you addressed it a little bit. I don't know if you had anything else to add just about how caregivers can make sure that they're taking care of themselves as well too.
Right. That's so important because I think we've learned over the years, like we say, the patient has to take care of themselves, and a lot of times they may have some limitations, and so the caregiver has to even do more. And they're just such wonderful people. What I've found is, first thing is we have done some good studies on caregivers. There's some really good data out there now. And we know that caregiving can bring on sleep disorders, can bring on stress, and can also bring on high blood pressure. So these things need to be monitored. It's what one important aspect is for the caregiver to go to their doctor and say, just check me over. I'm heading into something that's really hard. Things have really changed in my life. Am I physically okay to move forward? That's really important. So, and just make sure that they're okay. Caregivers get as tired as patients do. So that's what happens, and you just have to realize that caregivers have to stop and find that time. Also find some outlets. I think most caregivers have to realize what really makes me happy. I mean, if they're golfers, if they love playing music, if they love reading a book, how can I carve out that time to do those things so I can be better for my loved one? Because you're just exhausted. And some people won't take that help, and other people, please, if you're a caregiver, do take that help.
That's interesting advice too, because you always think of the patient needs to go to the doctor, but the caregiver should also go as well. So that's a really good piece of advice.
And one other thing with patients and caregivers, in our support group, we do a lot of laughing. And you say, are you kidding? Laughing. Yeah. But laughter and humor makes such a big difference. And it is what it is. Having a brain tumor is not the club you wanted to join.
Right.
But it's just okay because we're there and we're going to support you and you're going to support each other. So it's a wonderful place. And we find laughter really, really effective.
That's incredible. And so I wanted to talk, we talked about the initial diagnosis, and unfortunately, it's just all too common that even if you're getting the best treatment, even if you have the best surgeon, that these brain tumors they come back and they return. So I'm wondering what advice you have for patients who have just learned that their tumor has recurred.
It's really hard. It's really hard. And sometimes people know that their tumor is recurred because they have symptoms. But the bottom line is it's when you've had the MRI and the MRI shows growth. Then you finally say, oh my gosh, this is it. So you go to your doctor and the doctor looks at it and says, oh, now if you've been going to a general oncologist, it's a good idea then to see a neuro-oncologist for the reasons I stated before. A general oncologist sees 2% of his group are brain tumor patients. A neuro-oncologist, 100% of his patients are brain tumors. So if you haven't had a second opinion with a neuro-oncologist, it's a good idea to do that. And also consider clinical trials. And sometimes you have to tell your doctor, I'm interested in clinical trials. And there might be an option out there that might work for you. So I do think of that. Also, this is a time when a lot of people go online. And again, these advocacy groups, for which we'll put the links up on the Facebook page, it will give you there are several really good advocacy groups that will help you find a clinical trial or find the best treatment for you. So I just think it's something you need to think about. There are credible resources out there.
Fantastic. And I know that we'll be talking a little bit more about what clinical trials are too, because that's sometimes a new term for a lot of people also. I was wondering if there is, knowing that there's a high risk of a tumor recurring, is there anything that you can do in advance to prepare or anything to prepare for that, if anything?
Right. Yeah. Is there anything? Well, first of all, a lot of people look into next treatment options. They look into possibly what clinical trials may be going on. And so some of the people who actually contact Tocagen are doing that, just looking ahead. Could a clinical trial work for me if my tumor recurred? And they contact lots of people for that. So that is one thing you can do. Look into treatment options. Have a discussion with your doctor. Hey, if this recurs, what are my options? Again, if you have, so that's one thing. Get that second opinion before a tumor recurs, so you have your ducks in order. But I want to say too is that it's really hard because people are pretty anxious. When is this tumor going to recur? And especially when that MRI is coming up, it's called scanxiety, where people get so worried about their scans. But on the other hand, you can say, oh, what should I do? What should I do? You also need to live your life.
Right.
And enjoy your life. And many doctors tell their patients that. Live your life, enjoy it. And so every day think about how wonderful it is. What do I want to do? Who do I want to be with? So in addition to looking for what you need to get ready for your tumor, if your tumor recurs, remember to live life and enjoy it.
Mm-hmm. That's wonderful. And so in summary, I was wondering, of the hundreds of patients and families that you have worked with over the years, if you could summarize like 3 top pieces of advice that you would give to patients or their families as they navigate through this time.
Okay, I do. I have 3 pieces of advice. And the first thing is to trust your healthcare professionals.
Okay.
And they are your friends. And oftentimes they're a big support. Trust them. And you find your oncologist and your neuro-oncologist who's very experienced, and you can go with them. And I believe your healthcare providers, that's often your nurse practitioner, your nurse, and the social worker in the system. The second is to find support and lean into it. And when I mean that, you need people around you who will take care of things for you and say yes to those people. And interestingly, you think it's going to be one person, like someone who's always been your best support, but they may feel very uncomfortable about a brain tumor diagnosis. Right. And someone out of the blue will be that support. And they'll help you through the diagnosis. Maybe they know someone with a brain tumor. They've had a friend with a brain tumor. Maybe they've had a brain tumor, and that person will be your support. Or your family will come, or parts of your family. Have support and lean into that support because you need it. This is tough. The third, and I think a really important point, is to have positive energy, to surround yourself with positive energy. Take away the negative and just enjoy the good parts of life. It just makes such a difference. Enjoy that laughter. Enjoy the humor. Things that have made you sad and that you can do something about, they don't have to be part of your life. So trust in your healthcare professional. Get support and lean into it. And surround yourself with positive energy.
All really good piece of advice. That's excellent. I wanted to switch gears a little bit, and we talked about the importance of clinical trials a little bit before. And for many, this is probably the first time you've heard the term clinical trial. So I wanted to start with a definition, kind of a short, easy to understand explanation. But what is a clinical trial anyway?
So a clinical trial is a research study that helps people understand how a drug works. And the drug, so it usually, there's different phases of clinical trials that you'll hear about. A clinical trial can be in phase 1, phase 2, or phase 3. And phase 1 is safety and looking at dosage. Usually it's a small number of people, and they're just looking for the safety and the dosage. Now, phase 2, after they've figured out safety and dosage, is efficacy. Does it help people? Does it help people survive? Does it help people have a better quality of life? And then phase 3 is a larger study after they've had good results with phase 2, and they have people who've had, usually there are 2 arms involved. One is a standard of care arm and one is the treatment arm, and they want to compare whether the treatment arm is better than the standard of care arm. And these phase 3 trials are usually the trials that are required for approval for the FDA.
They're called registry trials. So phase 3 trials are really important. All of the trials are important, and you need all of them. But phase 1 is smaller, phase 2 is medium size, and phase 3 is a big trial that will tell us whether it should be approved for the FDA.
That's super helpful to understand. And so then just kind of to be fully clear, why are clinical trials important?
Clinical trials are the methods that the FDA uses to approve drugs. Without clinical trials, we will have no new drugs. It's that simple.
Thank you for clarifying
it's just the bottom line.
Yeah. And I know a common question that you've gotten a lot from patients too, and their caregivers who are looking at the clinical trials for them, is you find these trials that seem to be for a really small patient population. So it might be really specific. It might be one subset of cancer, maybe different ages. And I know that can be frustrating sometimes because you want to be in that clinical trial. Can you explain more why is that?
Right. And I've thought about this a lot because so many people that I've talked to will say, why can't you let me into that clinical trial?
Yeah.
They really want to be part of it. But a clinical trial is basically a research question. It's a question saying, with this group of patients, what will happen, and will this drug make that person better? Will they live longer? Or what they've decided. So you have to have a certain group to be able to do that. And you have to define your group, and that group has boundaries. And there are 120 different types of brain tumors.
Oh, wow.
So, yeah. So because of that, you have to choose a group that you can focus on. And you know information about that group. And so you start the trial on that group, and they have to have certain criteria. And it's that group we focus on. And then we follow them after they've had the treatments, and we see if they've improved by a certain percentage or a certain amount. And that's what we do with clinical trials.
And so having that small group means that you're really focused on, you're introducing any extra variables or anything like that. You're really focused on that group. And that means that you have a greater chance of getting that medicine to get approved too, as well.
Yes. Now, of course, it's approved for that group.
Right.
So sometimes that's a little limiting. But if you find positive results with this one clinical trial, then you go on and you look at other groups, and maybe that will work too. And that's what we always hope, is that we're finding positive trials, positive results with this one. So, oh, how exciting. Maybe we can move it to a different indication. And that's our hope.
Right.
Move it forward.
Yes. And I wanted to ask also, I'm sure there are many different reasons, but why would someone join a clinical trial? What are the reasons that you hear?
That's really a good question. I don't know if you know the statistics, but only 6 to 10% of people, adults, join clinical trials.
Oh, wow.
Yeah. Now, for children, most all of the children are in clinical trials.
Oh, wow.
Because we're so desperate to help those people, the kids that were willing to try, and the parents are willing to try clinical trials. And so it's very interesting. So why would a person want to go on a clinical trial? They want to go on because they want to support the science and knowledge. They want to move understanding brain tumors forward. What can we do to cure brain tumors? If not cure, make it a chronic illness. So they have that desire to do that. Another one is to be able to feel like they're contributing to the betterment of the human race by being in part of a clinical trial. If I do this, maybe my kids can live longer. I may not benefit from it, but somebody else can. And that's a really strong push for many people. Another one is that it's a novel treatment, and they know usually the statistics of standard of care, and they don't like those statistics. So what they do is they say, okay, I'm going to try this novel treatment and take my chances. And that's a group that's a pretty strong group as well. But the truth is, Monica, if people don't want to participate in a clinical trial, that's fine. Right. It is voluntary. Clinical trials are voluntary, and that's the truth. But if we don't have clinical trials and people don't join into clinical trials, then we don't move medicine forward and we don't get drugs approved. Right. We need them to get drugs approved.
That's a good point. And so as we're talking about the importance of clinical trials and why we need them, where would someone go? What's the best place to go to look for a clinical trial or one for your type of cancer?
Right. I'd start with my doctor.
Okay.
That's always the best spot. And again, if you're going to a general oncologist, you may want to consider talking to a neuro-oncologist, because neuro-oncologists are usually they understand what the clinical trials are out there. You know, we have clinical trials in immunotherapy, radiation enhancing, new techniques with surgery. We have targeted therapies. We have so many different types of clinical trials.
Mm-hmm.
It's worth talking to them. It's also another place that you find the clinical trials is on in the advocacy groups. Oh, one thing I wanted to say about with the doctors is that tell them early. If doctors know that you're interested in clinical trials, then they will say, oh, I think I know of something. It may not be at my institution, but this institution is doing it. Maybe you want to go talk to them. So that's really important. You have to be an advocate on your own, and that means looking at clinical trials online, and you'll find those online. There are several different places like clinicaltrials.gov.
Right.
And normally, it's not the patient who looks. It's usually a family member or a designated person who loves to gather information. Yeah. And most of us have somebody like that. Mm-hmm. And then finally, these advocacy groups are fabulous. They have registries for clinical trials, and many of them will personally navigate with you through the registries to find out. And again, you have your links.
Right, yeah.
But ask early, ask often. Mm-hmm. Some of the advocacy groups' websites also have the major brain tumor centers where they do most of the research. So take a look and see of the major brain tumor centers, because they will have more research.
Okay, that's really good advice. Especially speaking early on, I wouldn't think of that to ask my doctor about that too. So that's important.
Great.
So we talked about diagnosis, we've talked about clinical trials. I want to talk now about the living in the new normal. So after maybe you found a clinical trial, it's going well, or you're navigating a recurrence and going through that. What advice do you have for people once they're living in this new normal that might be a little bit different from what they're used to?
I guess I need to start to describe what is new normal, because people don't know what that is. Well, what happens when someone's had a brain tumor, it usually has caused some change in your brain. And also then commonly for malignant brain tumors, you may have radiation and chemotherapy. And what comes along with these is some neurological effects. And these neurological effects include memory loss, difficulty multitasking, fatigue, and other things like sometimes you may have, depending on where it is in the brain, you may have speech problems, you may have movement problems, you may have difficulty swallowing, maybe eyesight. And so these things do change, and just difficulty processing a conversation. And what all these symptoms lead to are changes in relationships. Unfortunately, less than 75% of people can go back to their jobs, which makes it very difficult. And so there's a lot of change, and it really hits the heart of both the patient, caregiver, and family, and those who love them. So we find that how are you going to handle this? I mean, you have to almost accept, okay, things are changing, and that's what the new normal is. I'm a different person, but that doesn't mean I'm not me. I really believe in the new normal. I've seen it so much that people can be their new person, and families can accept it. But the important thing to remember about this is that if you're having these symptoms, if you're not moving well, if you're not speaking well, if you're having problems with relationships, there is help. So you go to your neuro-oncologist and your nurse practitioner and your nurse and social worker and say, listen, we're having issues coping and managing this new normal. So what you can do is they'll order physical therapy, maybe even rehab for a while. Problems with thinking, maybe neuropsychological tests. Problems with speech, you talk to them. Problems coping. I mean, coping with a diagnosis like this and these changes is amazing, really difficult. So seeing a psychologist or talking with a social worker. And so this is the new normal. You become this new person. And it commonly becomes a spiritual change as well. When you were stressed out all the time, many people change their jobs. And they change to a less stressful job. And actually, life around the house can be better.
Oh,
yes. People will say that life is better. Why was I pushing myself so hard? Now I'm enjoying my children.
Right.
I'm home with my family. This is probably not the way I wanted it to be, but this is what's happening, and it's okay. It's okay. So there are good things that happen with the new normal, and it's very scary. Again, our relationships change, and we have friends who were there and may not be there now.
Right.
But we have new friends.
Yeah.
We have new friends. We find people in different avenues at the school, at the support groups, through connections online. There are many different, there's some great groups that connect people. You need your new communities, but don't give up because they're there. They're there.
That's good. It sounds like a lot of the reaching out for support, staying positive, a lot of those themes coming through too. And this is all important. You mentioned these doctors as well too, and we actually have our first question from Facebook. This is Mary who submitted. She's coordinating a lot of different doctors. She's a caregiver, and this is for her husband. She's coordinating all of his doctors, and she's trying to figure out, how do I best do this? You know better than I do just how many people there are to coordinate all of these doctor's appointments and things. Do you have some advice for her?
I do, and I think it's a really good question, and it's unfortunately more common than we like to think. I've talked to many people over the years over the phone saying, I can't get a doctor to take care of me because I've got a brain tumor and they're scared to death.
Oh, wow.
That's what happens. And then that's one thing. So a primary care doctor. But on the other hand, the best thing you can do, because many people, like you say, they might have heart problems, they may have diabetes, they may have even had arthritis or knee problems, but the doctors will say, I don't know what to do, you've got a brain tumor. So what we need to do is find a primary care doctor who's willing to oversee your other care. And that could be a nurse practitioner, because they're very skilled at working with you on these kinds of issues. So I recommend finding a primary doctor and saying, listen, I was diagnosed with a brain tumor. I have these previous complications, and I need someone to help me follow these issues. But I need you to collaborate with the neuro-oncologist all the time to make sure that we're talking. And it's a huge issue because these doctors are really worried, oh, you have a brain tumor, I don't know how to deal with it. So what we go back to is find a primary care doctor, commonly with a nurse practitioner, so then they can oversee your issues and then collaborate with the neuro-oncologist.
Thanks, Mary. And I hope that is helpful for Mary out there. So you talked about how common this is. I want to talk about another common experience that you get a lot of questions about, and that's about fatigue, which is defined as an overwhelming tiredness that's not solved by a good night's sleep. It's more than that. And this can affect both brain cancer patients and caregivers too, which you mentioned before. So What advice do you have for combating fatigue?
Oh, fatigue is a huge problem. Some people say it's an extra vital sign, and it should be discussed at every clinic visit. How are you feeling? How tired are you? And we know now that you not only ask the patient, but you also ask the caregiver, because they're exhausted from doing so much. And the patient's exhausted because fatigue comes on with damage to the brain, radiation therapy, and chemotherapy. So what do you do for fatigue? First of all, recognize it. It's okay, but it makes you do about a half as much as what you used to do before. A person can go and do the stuff, but their energy just stops in the middle of something, and that's it. It's amazing, and that's especially for patients. So the best thing to do, one of the first things, is to go and talk to your doctor about the medications you're on, and to see if any of your anti-seizure medications may be causing you issues. That's the first thing. And get that out of the way. Is there any problems? Do you have anemia? from that. That would make you tired. So that's the first thing. And then you figure out, when am I most tired? So timing is really important. So if you find out if you're tired in the morning or tired in the afternoon, and you learn to use that energy time in the morning and then rest in the afternoon. So that's really important. Try to get a good night's sleep, because if you're sleeping all afternoon, you're not going to sleep at night. So sleep hygiene is really good. Try to get a good night's sleep. Go to bed at a certain time, and that's important. The other one is rhythms. I think we've talked about that. Also, exercise is really important. There's studies actually showing that if you do exercise every day, your fatigue decreases.
Oh, wow.
And it can be walking around the block for 10 minutes. It doesn't mean to be a lot. Diet's important as well. If people have a diet high in processed sugar, interestingly, their blood sugar fluctuates, and that can cause you to be really tired as well. And one of the most important things is to ask for help. To say, I really need help. I can't do the laundry. I can't do this. You know what happens with people with fatigue? They just let it go. After a while, they say, I can't do this stuff, and it just doesn't get done. So then they have to prioritize what is the most important thing, because hopefully other people will be able to pick up those issues. And then some things just don't become important anymore.
Right.
It's amazing. Fatigue changes your life.
Yeah. Reprioritizing. And there was one piece of advice that I thought was helpful too, that you were saying that when you go to your doctor, it's important to bring all of your medications too.
Yes.
Maybe any of your doctors too.
Right.
So then they can just take a look and see what it is.
I think that's really important, because you could be on heart medicines, you could be on other medicines. And if the doctors know, they can decide if there are interactions with those drugs, and they can collaborate on the best way. But it's true. I always tell people, people can write them down, or else just bring your jars. Bring your medication jars, and then that's just one thing they don't have to say. Now, what do you take? You can say, here they are. Even if you have a bag full of medicines, that's okay.
That's good advice. So I wanted to turn now to our audience questions and make sure that we answer those. Thank you so much for that.
Okay.
And we have our first audience question. This is from Carolyn from Memphis, who asks, what are good resources for caregivers specifically to help manage the new normal that we talked about before?
It's pretty overwhelming. I would probably go in and talk to the doctor. I think, and if there is a social worker, have a discussion with the social worker right off the bat. I think it's really important to face the issue that there's a lot going on for caregivers. And so just to have that discussion with the social worker is good. Some of the advocacy organizations have excellent materials on caregivers and how to manage that as well. There are some caregiver support groups in the different areas around the country. Definitely look that up for caregiver brain tumor support groups. And they focus on caregiver issues. So I would suggest that as well.
That's good. And I'm thinking we can find that resource too and send that link out
I'd
too.
I'd be happy to give you those resources.
That's fantastic. And I think I'm getting another question. Excellent. And those are the other resources. There was another question that I had too, and that is about the search for treatments for brain cancer, because I know that it can feel really slow, and it has been slow. It's not just feeling slow. And a really common question is just, why is it taking so long? And are we making any progress? Is there any hope out there?
Yes. Brain tumors are tricky. They're tricky, Monica. Over the years, they have tried so hard. They think they have it. They have the right, there are different pathways and different mutations, and they feel like, okay, if we fix this mutation, we're going to stop it. And the brain cancer just seems to go right around those pathways and start back up again. So even if we haven't found defined mutations that by correcting them, that changes it. So that's one of the things. We think that we've got it, and over the last 30 years, we've put so much effort into it, but it is tricky. It's cunning and baffling, they say.
Yeah.
So that's one thing. But what have we done? But we're going to keep trying. And so we're using the immunotherapy now to try. We're doing a lot more work with precision medicine. So for each person, what do they exactly need, rather than just giving overall treatments. But we're getting there. But what has happened is we have better surgical techniques. We have more precise treatment where with radiation, we give the radiation and it doesn't harm people as much. So it's focused just right in the area where the tumor is. And we do have some medications that have provided longer survival. So we're making progress, and but it's just slow, and we just need more.
Right. Yeah. And I think it sounds like we're learning a lot, and there's hope on the horizon. Hopefully all of the, from Brain Tumor Awareness Month, all the funds raised will help fund that research too.
Well, I think so. The other part is that we have so much better support now. So when you have some of these issues and these symptoms, we can help you right off the bat. We can help you with nausea, with constipation, all of that. And we're not going to let anybody be left out in the woods. People can get help right off the bat. And that makes all the difference. And we understand now that counseling is important, and that living with a brain tumor is so essential. Get the services out there, and then people can move on with their lives.
Yeah. So that actually, we just have a question on that exact topic. This is from Jillian, who said that 5.5 years after diagnosis is tough. And she's wondering if you have any advice for how her and her husband can stay positive. You were talking about how important positivity is before. So I'm wondering if you have any advice for that.
Oh, 5.5 years. Well, congratulations on 5.5 years. You're still making it. I think that it's important to find out what's important for the two of you, to figure out what works for you to keep you happy. Is it being together? Is it going to the beach? What are those factors that make you feel good? And remember that each day is a really special day. I think that really helps. Again, if to stay positive, sometimes it's good to go back to your doctor and to your nurses and say, we're having a little problem with this or that, and maybe they can tune up a little bit and help you get some better treatment for walking or treatment for something. You don't give up on that, and just continuing to have that positive look forward, and just tell the healthcare professionals what you need. Maybe together seeing a social worker or seeing somebody to just work some of this out, because it's hard. 5.5 years is a long time. It's a long time to keep living with things that have changed.
Yeah, I think that hopefully that is advice that will help too. So I think that looks like we'll come to a close for today. And thank you everyone for joining. We see you on here. That is so wonderful. We hope this is helpful. And we will definitely be sharing the resources that we mentioned afterwards too. This whole conversation has been recorded, so it'll still be on our page if you want to share it with other people, rewatch it too. I know we may have been going fast at times, so that'll all be there. And we will also be sharing Mary's contact information. If you come up with questions afterwards that you're thinking about, we have her email in there, and feel free to reach out anytime. And Mary, thank you so much for being here, for your time, and for providing all these insights. We really, really appreciate it.
Thank you, Monica. It's been a pleasure to be here, and it's always a pleasure to reach out to brain tumor patients and families. I know it's hard, but it's something that if we all work together, we can move forward, maybe find the cure and learn to live with this brain tumor.